Nursing Week coming up May 12th through 18th. We know just how important nurses are. Sometimes we need to remind ourselves of that. The theme for this year's Nursing Week is raising our voices, speaking the truth. Nurses have felt under fire lately. A lot feel unappreciated. A lot more feel burnt out. We really need to appreciate our nurses, and that's what we want to do in this episode. We were looking around for someone here at Ontario Shores Centre for Mental Health Sciences who would best represent the best of nurses, of mental health nurses especially. And I think we found someone. His name is Nate Ballantyne. He has been a nurse here for 8 years. He is now the patient care facilitator in our adolescent unit. Nate Ballantyne will be telling us about why he became a nurse, some of his hopes, and some advice for people who want to become a mental health nurse. The Power of Nurses, right now on the Mental Health Podcast. Well, hi, Nate. Thanks for joining me.
Thanks, Kevin. Thanks for having me. Excited.
So I want to definitely get into your full story because it is a fascinating one. But first, I just want to start with the idea of a mental health nurse. Now we hear so much about nursing and the importance of nurses, but we always equate that with the medical nurse. Tell me about the differences and the similarities between the medical nurse and the mental health nurse.
Sure. So, as nurses, we're licensed by the College of Nurses Ontario, and there is, a competency expectation that we're well-rounded in all areas of nursing, right? So working in the medical, more medical area, there's an expectation that you would have some competency in mental health and vice versa. I think part of the reason why that may be so limited is maybe the stigma around mental health, and over the past few years, that stigma has been greatly reduced with things like Bell Let's Talk and just a more social awareness that we all have mental health and we all have the potential to struggle with those things. As a nursing educator myself, I kind of have my foot in both areas, teaching medical skills labs and clinical placements. As well as working predominantly in the mental health field, I try to make sure there's a balance of that present, because again we all have the potential to experience anything related to mental health, right? So and you can only imagine you're sitting in a hospital bed awaiting surgery or a procedure. It would be very easy to be anxious or depressed or, be experiencing any of those things. So for that nurse to have that foundation and skill to check in on that patient, conduct a mental status assessment, be able to provide interventions relatable to that is super important.
So essentially, though, a mental health nurse is performing the same duties as a medical nurse. It's the same qualifications that you have. There's just one more component actually added on top of that.
Mm-hmm. And there's a heavier focus when you're working in mental health on that mental health piece, I would say. I think a lot of mental health nurses, sometimes you hear them say, "Oh, I've lost those skills," when it comes to inserting NG tubes, dressing changes, those types of classic nursing type interventions. And yeah, you don't have to, right? There's ways to keep up those competencies. I know professional practice is working on bringing a program in that helps keep all of us here kind of refreshed and up to date with those skills, which I think is super important because things arise here, right? Like things do arise medically. Typically we would transport to a medical hospital, but sometimes we need to intervene in the moment. And having some of those skills is incredibly important. So yeah.
It is for people out there, for maybe some teens who are considering getting into nursing. What do they need to know about considering mental health, a mental health nurse?
Like if that's the
Yeah,
career
I mean,
path they
how
want
would
to
you
pursue.
encourage someone to maybe go that pathway?
Yeah, and like I said, the stigma's greatly reduced these days around mental health. I think a lot more students are kind of geared and interested in that right from the get go. But I think we still have this romanticized idea about nursing, healthcare. When you look at Grey's Anatomy and
Yeah.
ER and
Yeah.
all these awesome medical shows that are coming out these days. That's what. And I'll admit, me going into nursing at the very beginning, I wanted to be an ICU nurse. I wanted all the lines and wires and bells and whistles, and I think it's easy to get excited about that. But the good thing about education is it's well rounded. Most nursing programs, and you get a placement in most major areas of nursing, including mental health, right? And I think once students get to experience that, that's usually when they're like, okay, this is what I want, and then they start requesting that. For their final placements, we got a lot of great externs here that choose to come to Ontario Shores in the extern role just to gain more mental health experience and knowledge. So yeah, I think it is a growing area of interest for sure. Every year I hear more and more students saying, I think I want to work in mental health,
Let's
which is
get to
really
how
cool.
you got here right now.
Mhm.
When you were a kid, did you say, I'm going to be a mental health nurse when I grow up?
When I was a kid, I said I wanted to be a teacher, and the Scholastic Book Fair was my favorite thing. And I can't remember what grade, 3 or 4, but they had a play teacher set, and it came with mock report cards and pencils and activity, and I thought that was the coolest thing ever. And yeah, I always wanted to be a teacher.
Yeah.
Uh, at one point in my life, I was actually registered in a concurrent education program. Going to teach high school youth is the like that age range that I always wanted to work with. I worked in boys and girls clubs and youth groups and those types of things, right? So I had a passion for that age group, which is pretty cool. That's what I get to work with now at Ontario Shores with the adolescent program. So it kind of came around full circle in a way.
So how did you get into nursing then? What was there a
So
calling?
yeah, I was living downtown Toronto. I was playing in bands. I wanted to be a rock star. And I was working on Law McQuaid, and it was a really cool period of my life, my early 20s. My sister had gotten ill and ended up at Toronto General, downtown Toronto. Amazing hospital, amazing staff, and she was there for a couple months. I got some time off work. I got to go and visit her and be around that. I grew up with lots of nurses in my family. My mother's an ICU nurse, my grandmother, my cousins. Although it was never something I've really considered, but as I was spending time in the hospital more and more, I kind of was looking around. I was having one of those life epiphanies. I want my own family. I want a house, and I'm not sure the rock star life, is going to quite work out for me. So I kind of was like, maybe nursing is something I'd want to try, and I'd already explored that teaching avenue. So it kind of was dawned on me, well, if I become a nurse, then maybe I can teach nursing. Um, so that's kind of how that whole thing started for me.
Now, there was a particular incident that happened, a very sad incident, but it definitely was, I guess, that life-changing moment for you as well. Tell me about
hmm
that.
Uh, so when I was in third year of university, that's when you start your mental health rotation and education around that. Uh, we were doing our first orientation day. For that, we're at a conference room in a hotel. And when I had gotten home, I had learned that my uncle had died by suicide that day. And that kind of, in that moment, what I really wanted was the ICU and all this, intense medical type nursing. That was kind of what I was craving. And in that moment, uh, I started to think more about mental health. And when I had gone to my uncle's funeral, he was in the military, so they had a military funeral for him, and there was a bunch of officers there, and they were talking about how PTSD and these mental health struggles with Canadian soldiers is rampant right now, and they don't have the resources or services to treat them. Right. And so I felt like in that moment, I actually had that week gone down to the recruitment office for the Canadian Forces, and uh, my wife and mother-in-law quickly told me that was not allowed.
Yeah.
Nonetheless, I had randomly got in place on the adolescent unit here in Ontario Shores, and that was kind of like this aha moment for me, where I'm like, this is. I always wanted to work with this age group. I didn't know this existed in the context of nursing, right? Like nursing to me was always that medical model. Again, Grey's Anatomy. Everything's hustling and bustling and blood and IVs and all that kind of stuff. And I got goosebumps, and I'm like, this is it. So,
Are we teaching our nurses enough about mental health? Could we do better?
I, yeah, at the risk of not making the programs I teach and look bad, not at all. But yes, we could be doing more, and we are starting to, right?
Well, I think the
Like
same could be said of medical doctors as well. That we need to do. I think, and I'll put my opinion out there. That we need to do better at teaching medical nurses and doctors more about mental health.
Absolutely. And like I kind of mentioned earlier, like it's kind of wild to me that we don't consider that automatically, right? Anyone that is going through cancer, going through some type of disease, that's in the hospital waiting surgery, like if that was me, I would just be beyond anxious, most likely depressed. And I've struggled with those things before in my own life, so I can only imagine, how that would feel. So to me, that's huge. There's a huge mental health component to that, right? We all have mental health, we all have physical health, and they're deeply intertwined. And there's tons of research and evidence to show how they actually can affect each other, right? Like anxiety can actually manifest physical symptoms, and vice versa. So I do think there needs to be a little bit more of an emphasis, especially when we're delivering education around medical models. And I know for myself, and I think I have the advantage, having so much experience in the mental health area of nursing, is that I try to translate that as much to the medical side. I teach and lead all the skill-based labs for Durham College nursing program, and every opportunity I can get, I'll try to squeeze that type of learning into those medical scenarios, right? Just even just as simple as conducting mental status assessments with those patients. A lot of times we're given surgical patients Ativan, post-op for anxiety and stuff like that. And well, why aren't we conducting a mental status assessment around that, right? That's what we would do here before we gave out a PRN. Like a benzodiazepine or something like that. So yeah, just trying to carry that over and make it consistent with that. I think we should be approaching every area of nursing with both physical and mental in mind, for sure.
Sadly, you work in ground zero. Not sadly that you work in it, but sadly, ground zero of our mental health crisis that we're in right now is the growing number of adolescents with mental health issues. It's epidemic.
Well, we're starting to see the result of COVID, right?
Yeah.
Like it was kind of a slow, but all the schools shut down, right? Some kids didn't have classes for a whole term, and then they go back and it's all online learning, computers. The socialization is reduced maybe to nothing, depending on how strict those families were about going out. And now we're seeing that effect 3-4 years later. What does that look like, right? Because that is the pivotal moments in their developmental milestones that kind of got halted abruptly, right? And we're seeing the results of that now.
And on top of all that, we have a generation that's being told, you know what? We kind of spent all your money. Chances of you buying a house are very slim. The job prospects, you know what? Your university degree may mean nothing whatsoever. So we've got this very anxious generation. Tell me about working in that atmosphere.
Yeah, so it's there's parts of it that are inherently tough about it, right? Like when you consider developmentally with this age group, they are inherently concrete, and that is normal biology, right? Like at that age range, some ideas, some concepts are difficult, if not impossible, to understand. So,
Give me an
I mean,
example when you say inherently concrete. What do you mean?
well, so do you remember being a teenager and telling your parents that they know nothing about you, and that they have no idea how life is, and your parents are telling you,
No,
well,
not
we've
me,
been
Nick.
through
I was a
it. Yeah,
perfect teenager, and
right.
yeah, I never went through any angst like that.
Right. Even just that, like that teenage angst, that is totally natural and normal, right?
Hmm.
So you're working. It's almost like you're working against the grain with this age group because you know the things you're telling them may not land, right? So I think a big part of adolescent care, and essentially it's pediatric nursing, which would involve a triad, right? The mother, father, and child is one considered one as the patient, so I really think they're the most one of the most important focuses is giving the parents support, right, so that after discharge the parents can continue to help, um, you know uh, uh, encourage the practice and use of these skills for these kids to get through these hard times, so onto adulthood, right, so they can help see them through, to the point where they start to recognize and accept, you know how life is, and um, yeah.
And we are again seeing an increase as well in things like eating disorders, and we know that eating disorders are the number one killer when it comes to mental health illness. That they have the highest mortality rate within that. I'm just learned that not too long ago, and it blew me away. To look into the adolescent world of mental health, and again, this is someplace we need to do more. So now, with your experience, and the thing is, when you want to really know a patient, you don't ask the doctor; you always ask the nurse. So, in your experience and your thoughts, how could we do better? How could any parents out there listening? How can any teachers out there listening do
Yeah,
better?
I feel that's tough. That's a very subjective, as a
Yeah.
parent myself. um, I'm again very big on that pediatric style model, right? Like I always give those moments of support to the parents as well, check in on them, make sure that they know that we're here for them too, um, and not passing that judgment onto them, because sometimes I'm like, oh man, I don't know what I would do in that situation, right? Like my children are small right now, and I got another 10 or so years maybe before we get to that point where they might start experiencing these things. And to be honest, it scares me to think about that. I don't know what I would do in their shoes, right? So I really work really hard at refraining from judging these situations, because I couldn't imagine their position right now, right? So I think it just comes down to just trying to listen, trying to understand, right? And I think maybe even just a little, you might need that little bit of extra compassion and empathy, right? Because, uh, like you said, with like the teenage angst and all that, like sometimes what, as parents, what we're trying to say to the kids isn't going to land and isn't going to get through as effectively, but just kind of approaching it with that patience and grace, and not giving up. I think
What
that's
What
what it
about
is.
your mental health? We know that nurses are reporting burnout. They are reporting feeling unappreciated a lot of times. A lot of them are leaving the profession. Some of our
Mm-hmm.
better nurses are leaving the profession. What about you? How are you feeling, and what do you do about your own mental health?
Yeah, so I mean, it's been a journey. I mean, my biggest, I think the biggest impact I had with mental health started in nursing school. You learn so much about the human body, that sometimes I think you develop anxiety from it. So I actually developed a form of health anxiety in my fourth year of school, and started having panic attacks, and started going down the Google rabbit hole. And every day I was dying of something different, and that that really overtook me. Um, I guess I tried to ignore that for years. You get into the field, and then just the pressure of the job itself, starts to bring you down. So the first few years, I think I struggled a lot. I think I struggled with the idea of getting help and medication. And you kind of have this whole mantra like, well, I am a mental health nurse. I already know all that stuff and it's not going to work for me. And, it totally worked for me when I finally was able to, I guess, give in and actually go to the doctor. I got on some medication, started therapy, and it was one of the best things I ever did for myself. And I think routine is a really important part, especially if you work in shift work, right? Like you got to find a routine that works for you, that just kind of keeps you grounded. For me, that's trying to do 75-80% of my diet is, meal prepped, clean eating, make sure I'm going to the gym 3 times a week, take a walk every day, try to get 7 hours of sleep at night, drink lots of water, those types of things.
Mm-hmm.
I find really, really help. Look, you're always going to, I mean, maybe you're not, but for me, there's always going to be some kind of baseline anxiety, stress in your life, right? Like kids, house, marriage, career, you're working 2 jobs just to pay the bills. This is
We
kind of,
all have stress, and I guess mental
yeah,
health is how do you deal with that stress?
right. But if you don't, that's when it can quickly come all crashing
Mm-hmm.
down and become very complicated, right? So I learned that the hard way for a couple of years, and then kind of put my butt in gear and got the routine going. And I feel like for the past few years, it's really helped me thrive. I think I've found my confidence. I've found my voice. Job satisfaction. Yeah, routine.
Well, you wear many hats too, so we know that you're a mental health nurse. We know that you also teach, but you wear other hats as well. Interestingly enough, you produce videos. Tell me how you got into that, what you're doing with that, and then we're going to get to how you're using that to promote better mental health.
Sure, totally. Yeah. So I've been a lifelong musician. So art has always been, actually, I graduated grade 12 with grade 10 art, grade 11 art, grade 12 art, photography, graphic design, yearbooking, English. So essentially I couldn't go to college or university, but I don't know why the guidance counselor let me do that. But I wanted to be an artist. That's always been my lifelong dream. So one day, I've got this band and I've got all these songs and I wanted a music video. So I was pricing it out. I'm like, oh boy, these are, really expensive. Maybe I'll buy my own camera and make my own music video. So I bought the camera, never made the music video, but started a production company about 6 years ago and started with producing music videos for artists, and now got into documentary and filmmaking, which I think is my biggest passion and where I kind of want to go with that. And a lot of that has been really meaningful. I've done a lot of video production in the nursing education context, whether it's filming and creating simulations for students or little mini documentaries on lived health experiences with a particular disease, to full-length documentaries. Yeah, I'm excited about where that's going.
And so right now where it's going is a very timely topic, and that is mental health medication, which
Yeah.
again, we need to do so much better in. Tell me about this latest project.
Yeah, so I wrote a script. It's called Sertraline. That's actually the medication, Zoloft, that I went on, and it did wonders for me. And it's tough with some of these
Same here, by
medications.
the way, as well. I'm on sertraline, and yeah, it as long as you have a doctor who's working with you, and you get
Yeah,
the right balance, the right cocktail, as they call it, it really does do wonders.
100%. So there's a caveat to this particular medication, and that is that the loading phase of Zoloft can be quite difficult mentally and physically to handle. So sometimes you hear that saying, it's going to get a little worse before it gets better, and that is very prominent with this medication for a lot of people, especially. And here's the other tricky thing too, right? most people are getting that medication ordered by a GP. And sometimes they don't order the medication maybe at the right dose for that loading phase. So, typically we'll see it started on 12.5, 25 milligrams, and it titrates up, kind of like a gentle increase for your body. I had been put on 50 milligrams right off the bat, which I think might have possibly contributed to the experience I had. But basically, it was 2-3 weeks of nonstop panic attacks for no reason. I couldn't make any sense of it. I actually wanted to go off the med because I thought, you know what, I could handle the anxiety I had before. I feel way more anxious now. The doctor just encouraged me, once it levels out in your blood, everything's going to be okay. And so I pushed through, I persevered, and one day I just woke up and I felt amazing. I didn't feel that anxiety or that stress, and it really helped me deal with some things in my life, learn some new coping strategies and skills, create that routine that I needed. It's not always a forever thing, right? Like, I'm not on that medication any longer, but I think it was a very important and necessary time in my life that needed to happen. I'm glad it happened. So this movie is written to kind of empathize with those that go on this medication and that maybe experience that loading phase that's a little rough and a little worse than before it gets better. And the idea is to kind of illustrate that through these visuals, to really connect with people. And the hope is that it becomes kind of a platform to just continue this ever expanding conversation about mental health in general, really. So.
Okay, well, this is fantastic, and you are such a great role model. And as we head towards Nursing Week, we need to realize, first of all, we need more than a week. It should be 52 weeks out of the year that we do appreciate our nurses. So thank you for what you do. Thank you for what all nurses do, whether medical or mental health nurses.
Absolutely, yeah. Thanks, Kevin. Thanks very much.
During our talk, Nate had spoken about suicide. And I always like to take this opportunity that if you yourself are in crisis, if maybe you are thinking about suicide or you have a loved one you're not too sure about, I urge you to call 988. That is Canada's mental health crisis line. That is a line you can call 24/7, 365 for a non-judgmental ear to listen to and for some good advice that may help you go onto a better path. Thank you to Nate, and thank you to all of the nurses for what you do. Stay strong. I'm Kevin Frankish. Until next time, take care of yourself. Take care of each other.